The new COVID overnights may require intubation. But
one of the front lines in the fight against COVID-19 is right here. This is the final hour of Dr. Garrett Poulet's 12-hour ICU shift at Humber River Hospital.
We also have a presumed COVID that came to your side as well from a nursing home.
On this day, there are 15 COVID-positive patients in the intensive care unit. They are not the only ones battling this silent killer in the hospital, but they are the most sick.
We're not sure exactly where they're going. A lot of them are intubated for weeks to months from experience in China, Italy, if they survive. She's working hard and her oxygen levels are too low.
Survival is the main focus of everyone working on the 6th floor of this building. Between patient visits, these doctors speak candidly about the struggle they're facing.
We're learning. We don't know. We have never dealt with patients like this before.
Amid the calculated care they provide, there is some confusion.
We don't really understand what's happening with these patients.
Is that more concerning though? Because there's no book, there's nothing to follow.
It's all random, exactly. We don't understand it yet.
So they protect themselves from head to toe to shield their own bodies. If they're afraid, you wouldn't know it.
Have it out so that in case we need it, it's ready.
And as we will soon see, there is little time to dwell.
This is, really taking it to the highest level.
They work in spaces where physical distancing is not possible. It's hot, it's loud, and it is non-stop.
You just have to assume that everything has COVID.
You worry about bringing it into the home?
Yeah, definitely. Yeah, I think we all do.
Families?
Yeah, exactly.
I'm scared that she's going to fatigue and stop breathing.
Yep.
Okay, I'll get started with that.
The team is heading straight for a 62-year-old female patient. She has diabetes, had a previous minor stroke, and after a week at home with flu-like symptoms, shortness of breath landed her in Emerge. It's decided she needs intubation.
I'm concerned that if we don't do it early, we're going to be doing CPR on her chest because she will go into respiratory arrest.
Dr. Caryn Lieberman will suit up.
Normally before the COVID era, if someone had to be intubated, we'd all, we'd put on a mask, but we'd really all kind of rush into the room and intubate a patient. Now we have to do things a lot differently.
The intubation process is, for you, the highest risk moment, is it not?
It is the highest risk procedure that we do.
Right.
Because COVID-19 in the airway could be aerosolized if it go into air. So we use full protective equipment from head to toe.
Then we'll put the blade in.
The team is calm, focused. There is a clear-cut protocol to follow.
It is a higher risk procedure for the healthcare workers, but also to the patient because they can desaturate very quickly. We're going to take good care of you.
Even in the most intense moments, there is time for compassion.
She didn't have the support of the breathing machine, then her muscles would tire out, her oxygen level would drop, and she would likely pass.
Yeah, there's one right there, Jamie.
It's a difficult intubation, a sign nothing is clear-cut with COVID-19, except that the health of these patients is precarious. They can deteriorate quickly.
Face shield.
Dr. Jamie Spiegelman layers up in the appropriate personal protective equipment. He's going to help.
Hey guys, we need a crash cart! Crash cart!
The patient has lost a pulse. For a few moments, there is a feeling of panic. The doctors and nurses are desperate to save this woman.
Heart could always fail, their kidneys could fail, their liver could fail.
For 10 seconds, her heart stopped.
Everything's good now. She's stable.
Now she is hooked up to a ventilator that will breathe for her.
How nerve-wracking was that for you?
It is stressful because all you want to do is help, but just watching them desaturate so quickly and not be able to do everything that we can all the time to help them it is really frustrating, and it's terrible.
But the patient is alive, and that is a victory worth celebrating, if only for the moment. Caryn Lieberman, Global News.